Members of the Mayor's Poverty Reduction Initiative are ready to move forward on several important action items. The initiative includes efforts by 6 task forces to improve the quality of life of residents living in Northeast Central Durham. As one of its first steps in doing that, the Health Task Force is developing a community health worker program that would help connect residents to health-related resources.
The idea behind a community health worker is that these are people who help individuals navigate through the healthcare system. So, for example, if one is focused on diabetes, they might come to your house because they know that you are being treated for diabetes, and they might ask you, do you have your medication? They wouldn't ask you, what kind of medication do you have? But they would ask you, do you have your medication? So make sure that you've actually been able to get to the pharmacy and that you can afford to get it. If you don't, they'll help you figure out how to get it. And they'll ask you, are you doing everything the doctor said? Do you have a way to get to your next doctor's appointment? It's really kind of a holistic approach to helping people help themselves.
The program will initially start with the hiring of 3 part-time community health workers for 12 hours a week, each who will be focused on this area.
Our plan at this point, we're working on creating a certification program at the health department and working on putting together a training program so that people can get trained and can get certified as community health workers.
The first workers will be hired and trained during August, and the program will be implemented in September. The goal is that the health workers will live in Northeast Central Durham and will be actively involved in the community overall.
So if these folks are in the community at a potluck or some other community event, and they hear someone talking about challenges they're having with their own health care, we want these people to go, hey, wait a minute, that's my job, and to engage with them right there on the spot, and to help guide them to where they can get assistance. So they might not open up an office in the moment and conduct office hours, but they might give them their card and say, I can help you with this problem. I'm a community health worker. Let's get together and talk about it.
The cost of the program is expected to be approximately $25,000 a year.